Thank you very much for allowing me to talk to you. So I'm going to talk to you about a recent study that I did. That's called Alzheimer's disease and Parkinson's disease predict different COVID-19 outcome. So using the UK Biobank, which had 500,000 people, 13,000 of them tested for COVID-19, and more than 1,000 of them were positive, and unfortunately 300 of them died. So we looked at several factors, comorbidities, and using an unsupervised machine learning method, we selected the most relevant ones, and then we analyzed using binomial regression the risk of infection and death. And I was really surprised to find that dementia actually predicted a higher risk of dying and as well as getting infected. So people with dementia were more than 3 times likely to get COVID-19 and also to die from COVID-19. So then I thought to explore different subtypes of neurodegenerative diseases. And I found that Alzheimer's disease and Parkinson's disease both predict an increased risk of getting COVID-19, but only Alzheimer's increased the risk of dying from COVID-19. And in fact, it increased more than 4 times the risk of dying from COVID-19, whereas Parkinson's disease didn't affect death. So my main finding is here, which is that Alzheimer's increases both the risk of infection as well as dying, and Parkinson's disease only increases the risk of infection. I have a poster, so you can have a look on my poster for more data and more detail. Thank you very much.
Thanks so much, and for sticking to time. So that's a fantastic data set you've got there. So let me see if there are any questions for you. Do please ask questions.
And I have some extra slides as well.
Yeah, please show another slide, and could you let us know, could you speculate as to the mechanism of what you're seeing? Why do you think that's the case?
Yeah, absolutely. So the extra slide is basically the descriptive statistics of my data, which is basically most of the population is white, and we have an older cohort, and the average age is relatively older of those people who got tested for COVID-19. We have about 200 people who have a positive diagnosis of dementia, and within people who have a positive dementia diagnosis, about 51 people are positive for COVID-19. And about the mechanisms, I think that's a very, very hard question. Professor John Hardy in the previous session actually briefly talked about it. So basically, he mentioned that people with Alzheimer's disease actually have a similar immune signature that was increased as people who got COVID-19. So presumably, people, my hypothesis will be that people with Alzheimer's disease already have higher burden in terms of their immune system than people without Alzheimer's disease, and that may predispose them to increased likelihood of dying in comparison to people with Parkinson's disease. Yep.
Okay, well, thanks so much again for a very clear talk.